Okay, I'm with Dr. Indira Mysorekar, and we are talking together because I saw a study that you just did, and I'm going to bring it up on my phone really quickly. It is this. It's in the Journal of Urology, and it says bladder mucosal cystitis cystica lesions are tertiary lymphoid tissues that correlate with recurrent urinary tract infection frequency in postmenopausal women.
That's correct.
Can you break this down for the
Yes,
lay
I was going to
person?
say that's quite a mouthful. Yes. So my thanks for talking with me, Deb, and I really appreciate your amplifying our research so that it goes out to people for whom it's meant for, and who are always in my mind when we do research in the lab, because we don't get to see the patients, but we're still working for them.
Yes.
So one of the things I just give you a little bit of a historic thing is that my interests have been in studying infectious diseases. So I was studying urinary tract infections and what we called pathogenesis, which means the process of the infection and how it occurs, what happens during the infection, what happens after the infection is cleared. And to really break down all the things that happen, we use animal models because we can't really test people for these things. So we use an animal model. And we use a little mouse that's bred in the labs for this purpose. And their course of UTI is actually very similar to what happens in a human, in a woman. And so during the course of this, we learned about how the infection occurs and the response, the immune response that we mount to deal with the infection, and what are the sort of the after effects of infection. And then what if you have multiple infections? The bladder doesn't completely heal itself, and then what happens if you're exposed again to bacteria, and so on and so forth. So in the process of studying this, of course, we knew and have always known that UTIs are very common in women, but as we get older and postmenopausal, they become even more common. Yeah. And even though this has been known for a long time, we don't really know why and how. Obviously, they say, oh, it's because you're menopausal. But what does that mean?
Right.
What does becoming menopausal mean that suddenly you have more UTIs? The bladder is still the same and still doing what it's doing. And so we started investigating and trying to understand why that was. So we first started with animals again. So we started looking at much older animals. So this is equivalent to a woman in her late 50s or 60s. Mm-hmm. And we found even without any UTI or any kind of doing anything to the mouse, even at baseline, just an aged mouse, that their bladders looked very different from a young female mouse bladder. And one of the things that we found that was very dramatic is that there were these big, what are called lymphoid follicles, lesions inside the bladder. And what lymphoid means is that they're made up of lymphocytes called T cells and B cells. Mm-hmm. And B cells are the ones in our bodies that make antibodies. So, when you get a vaccine, or you get an infection, our body uses B cells to make antibodies so that when you get infected again, it recognizes that you were infected the first time.
So the bladder is essentially filled with these antibodies. Why, right?
Young bladder doesn't have that because this job is done by our spleen, our lymph nodes, the lymph nodes that are here, the lymph nodes that are in our arms. And of course, and throughout our body, these lymph nodes are the ones that monitor your vaccines, your infections, and mount the response and keep a memory of you've been infected before. That's why if you get a measles vaccine, we don't get measles again. Right. That sort of. So this is all thanks to B cells made in our lymph nodes and in our spleen. So an organ like a bladder doesn't have lymph nodes.
But suddenly it does, like in the older woman.
But in a postmenopausal woman, it has a little lymph node sitting inside it. So you can easily imagine now suddenly if you've got this lymph node signaling structure, now it's reacting to everything and making antibodies and producing new signals that are completely changing the environment of the bladder. So now, under these conditions, if you get exposed to a UTI or other things, or yeast infection, or general, as we get older, especially if you've had children, like, the whole pelvic floor is a little looser, everything is a little, droopy. And so much more likelihood of, there being an environment which is different anyway.
Right.
Plus, immunologically, we're different. And so we showed that, and then in our animal, we were able to show that the aged animal was much more likely to get recurrent infections. So then we wanted to see, okay, are any of these things happening in women? So in women, we use a cystoscope. You just mentioned that, which is a little fiber optic camera that can go through the urethra and then look around in the bladder.
I just had one. It's not pleasant, but it's fine.
And it's a very, like, sort of at least a relatively non-invasive way to look around. And so for the longest time, people who have been doing this, or whenever, as long as the technology has been available, they've known that there's these sort of raised lesions. So if you look inside, what will be seen is like a pink shaped ball.
Yeah.
And then some people have noted for the longest time that sometimes you have these little lesions which are raised, like little bumps, like, if you've got a mosquito bite, you get a little bump.
Yeah. Mm-hmm.
And they're slightly reddish brownish. So they stand out from the generalized pink background. So people are like, oh my God, is that a cancer? So they biopsy it. No, it's never been cancer. So therefore, it's always been ignored. But we went and biopsied those little lesions and found that they were these little lymph node structures in the postmenopausal female bladders.
And so what does that mean for the bladder? So, all right, so you're having lymph nodes where they've never been before.
Exactly.
Inside the bladder, producing B cells to fight off infection. Why? What's happening?
Yeah, so that's one of the areas we're studying. So this paper that you just showed, it basically describes the fact that we see these lesions in the postmenopausal bladder. And then we looked at almost 500 women. And we also then crossed cystoscopy records of 500 women. And then we cross-checked with how many of these women had a history of recurrent infections, which means at least 2 to 3 infections per year in a given year. And then a bunch of other data about their health and everything. And then we found, when we cross-checked, that these lesions had a much higher rate of recurrent and frequent urinary tract infections. Right. And also, importantly, the time difference between the next episode of infection was shorter, which means that, there's all this reactivity going on. And so we described that. Then we described all the what's called the pathology of these lesions and showed very clearly that there are these lymph node-like structures which have specific features to qualify as a lymph node-like structure. And they have these B cells and also T cells, which are very important in of course, in cancers and autoimmune diseases and everything. So what we think is that with age, the bladder changes in terms of, sometimes it becomes a bit leaky. So now you have waste products that are in the urine, instead of just being held away, now they can potentially cross back into the tissue and cause a lot of irritation. And then that may trigger a lot of sensation that maybe there's something wrong in the bladder, and maybe that recruits more immune cells to come in, and then they organize into this lymph node-like lesion. But when it's there, then maybe there's a much more like an autoimmune like sort of reactivity, where even if it's a small amount of bacteria that come in, which normally maybe we would just ignore, but maybe now, since we're like hyper reacting to it, or it's like if you've been frightened once in an area, you're going to be jumping much more likely if you go to the same area, right? Because you're kind of sensitized to it. And so we think that having these lesions sensitizes you to having a much bigger response to infection, or a more sustained response to infection. And certainly the data correlation is like, yeah, there's more UTIs, there's more recurrent UTIs. And so now we're both in the people and in our animals, really trying to break down why that is, the question that you asked. Why is this happening?
And can I ask a dumb question here? So
no dumb questions.
This is a dumb question, or it's a question for somebody that
there's
doesn't.
There's no dumb questions. All good questions.
I bringing it to a personal level. I've had I was having recurring UTIs, then I went on vaginal estrogen. They seem to go away more or less. I would have a few here and there, maybe like 2 a year rather than 2 every month. So now I'm back to having more and with a week in between, which to me means the infection never cleared, or if it
Yeah,
did.
it's not clearing, yes.
So then how, all right, a bunch of different questions. How do you clear an infection that's not clearing? Why are these infections not clearing? I'm on a 7-day antibiotic course.
Mhm.
Cipro has stopped working. Bactrim has stopped working because I've had this long history. Are there bacteria in the bladder itself, or is it coming in from the outside? I mean, I'm asking a bunch of questions, but it seems
No.
I've been so careful. I mean, I have a bidet at home. I make sure I have a shower before sex. I make sure my partner showers before sex. What else can a menopausal woman with recurring UTIs be doing to not have them?
No. All very, very good questions. And literally, like, I mean, behavior, of course, plays into things, but in this particular case, like we ourselves have shown in mice and in people that the bladder itself can harbor bacteria.
That's
And
what I
other,
think is happening. I really
yes,
do. Okay.
and it doesn't matter if you have sex or don't have sex, or wipe one way or wipe another way, like you can still get UTIs if you had these bacteria inside your bladder, and they can get up there for any number of reasons, you know. And then importantly, once they get up there, they can stay there for months on end and potentially years on end. So it's like, you know, it's not even anything people might be doing today. It could be like, you know, things that happened a month, years ago, or things like that. And so we've shown, and others now have shown that, in fact, in that issue of your Journal of Urology, there are a couple of other papers showing that if you take biopsies of bladders from postmenopausal women, and you look for bacteria with using the genome sequence of bacteria, and or culturing them, that you can actually, or imaging or visualizing, you can actually still find bacteria in there.
That they're just living in the bladder.
So they're not like it's not an infection per se, because
Right.
an infection means that the bacteria are like multiplying at a rapid rate, and going from, like, you know, 1 to 1,000,000 or something in
Right.
a short period of time, which is what happens when you have an acute infection, and or that there's a very active immune response going on. But you can have bacteria, you know, we're like 10 times more bacteria in our bodies than we're human cells, you know that. So there can be a lot of bacteria living there, and they might be like interacting with the immune cells. They might be like triggering these lymph nodes, you know, to tickling them a little bit, you know.
Right.
And so, but once you have bacteria established, they can actually stay in there for a long time. And maybe there's like a um, low level of irritation. So one of the things I always advise women is, you know, when you have, you know, as you described, frequent recurrent UTIs, like, is it a culture positive UTI every time?
Not every time.
Yeah, not every time. So a lot of what you might be feeling is a sensation of irritation and pain, but doesn't necessarily mean that there's a ton of bacteria there, which is why sometimes antibiotics don't work. It could be that there's, you know, like it's just like, you know, a kid who plays, you know, sports a lot, and they skin their knees, and then things, you know, heal up, and then, but before they're fully healed, they go and they skin their knee again, you know, it just gets worse. Eventually it never becomes a completely untouched piece of skin, right? There's always a scar or a little gash or a little redness that remains, and our insides are exactly like our outsides, you know. And so one way to think about it is like, the bladder, once it has had a few UTIs, kind of like becomes a scarred area. And so even if you don't have new bacteria, even if you put like a little salt in it, or you're dehydrated, or, you know, you ate a lot of cookies and cakes, and so there's a lot of sugar in your urine, which might trigger, you know, a little bit of activation of a response. All these things can trigger your nerves to tell your brain that you have a UTI, but you may not. You may not have an active UTI, which is thousands of bacteria growing in your urine. If you may not have that every time, you know. So
Well,
people really should look at the urines, look at what they're seeing. Are they seeing bacteria in the urine? Not just a culture, but looking through through a microscope, which they can do. And then are there many immune cells coming through? Are you getting a lot of the bladder cells shedding into the urine, which we have seen and shown in postmenopausal women, that they have like shedding of our lining, basically.
Like the uterus.
Into the urine. Yeah. But I mean, the uterine shedding is like massive, like a lot of it, but this is like a little bit, like the cells just like sort of die and
So would
fall
that
off.
would that be a reason why there are leukocytes in the urine, but no
Yes.
infection?
With no, exactly, you absolutely got it. And so leukocytes, when I said lymphocytes, leukocytes, they're the same sort of thing. Like lymphocyte describes a type of leukocyte. So we have red blood cells, right? And then we have the white blood cells. And leuko means white. So leukocyte is white blood cell. And so our B cells and our T cells are all white blood cells. And our, neutrophils, things that, if you get a scratch, the very first thing that comes in, they're called neutrophils. And they're also leukocytes. These are all like white blood cells. So when you have those without bacteria, it really means that you have like a scar or a wound that's not healing.
So the major question especially for people that are reading this Substack, because I have a lot of women who are postmenopausal or perimenopausal. What's the solution? I mean, I was told yesterday by a male urologist who I am never going back to several things. He told me perhaps refrain from vaginal sex, take a bleach bath, take a daily
never
take a daily macrobid. Oh no, daily macrobid, and I mean, just things that I just thought. Oh, and then he had the temerity to suggest that since my partner is around my age, that he won't be interested in sex anymore. So, shouldn't be a big deal. I mean, this is what I just dealt with, and I write about this.
It's incorrect and inappropriate. Almost pretty much everything that he's told you.
So what would you suggest to somebody like me with recurring UTIs? How do you fix them?
Yeah. So as I mentioned earlier, one of the first things, and this is in general, first I'll give the general advice, which is that it's as much as we can. Like obviously, if one lives in a small town, there may not be access, but for any woman who, postmenopausal woman particularly, and you're done with having babies, so you don't need to see an obstetrician, that I recommend people to go see what's called a urogynecologist. So urogynecologists train as obstetricians and gynecologists, but they don't do the, deliver babies part. They learn to operate on our bladder and uterus and vagina. So if they're doing hysterectomy and stuff, these people are the ones who do it. And the advantage with the urogynecologist is that since they're trained as obstetricians and gynecologists, they are always trained in women's health.
Great.
And they understand that the women we are today, are potentially seeing the effects of what happened to us when we gave birth to children, or things, how the delivery went, or other traumas, or, whatever, like we're seeing today in our general lower urinary tract, pelvic floor area, are things that might have happened 20, 30 years ago.
It's a history book, basically.
It's a history book, right? And we carry that history, right? We carry the scars on our body inside and out, right? And your gynecologist understands that because they trained with women, young women, and then pregnant women and post-pregnant women and so on. So that's just a general advice, and better not to go to a urologist unless you have bladder cancer or something
I literally
else.
just went to this guy because my gynecologist was in the same practice as him, and she just wanted to get a cystoscopy just to see what was going on. Yeah. And I will never do that again. I will seek out.
And I don't mean to at all, just to say this, I don't mean to at all say anything about the competency of urologists or their ability to do their job. What I do mean is that when a woman doesn't have a very specific problem, like full-blown bladder cancer, or full-blown something specific, then often the urologists don't really take it seriously.
Yeah.
And that's just part of their training. They don't really train that much on women. They train more on men. So they understand if a man goes and says, I have severe prostatic pain all the time, they take that seriously.
Of
But
course.
if you say that you have all this pain inside, they say, I don't have sex or something random like that, which they never say to a man.
No.
That's general, so go to the doctors that understand your things.
Yeah.
And secondly, if you have a history of UTI, which it's not just, especially when you're older, when you're postmenopausal, UTI is not a simple bacterial infection. It never is anyway, but in a postmenopausal woman, it is not ever just a simple bacterial infection that you treat with antibiotics, the 3-day course, 7-day course, it's all gone, finished, you're over, and it doesn't happen again. It's not like that. There can be multi-factors involved with your immune response, your diet, if you have other comorbidities, and if there's obesity, if you've got diabetes, or you had a lot of tearing when in childbirth 20-30 years ago,
Right.
all kinds of a botched episiotomy, whatever, it can be any number of things, other surgeries, right? And then simple age-related things where so we have this big muscle which is kind of like the way, think about a swing, a sling, like if you carry your arm
Carrying
in
the
a
baby,
sling,
yeah.
the thing like a sling, yes. So on the top is the bladder, and then there's the vagina, then there's the colon, with our anal opening.
Right.
So the bladder, the vagina, and the anal opening are like boom, boom, boom in a woman, right? And then and they're all like held together in this little sling pouch. And more often than not, when you've had children and multiple children, that sling is torn up. And even though it heals, it's not completely ever healed. And so what happens is that the vagina then kind of like collapses a little bit on itself. And because the uterus has now become small because it's not menstruating anymore. And then the colon is where it is. So now everything is kind of like shrinking down. So what happens is there's more likelihood of incontinence and leakiness, and like when we cough or things like that, or when we laugh a lot.
Yeah.
There's that. And that's just age related. And you don't even had to have children to have that. Some of these are just age related changes.
And I've had 3 children and 3 surgeries down there. I had a hysterectomy, then I had a trachelectomy, and then that trachelectomy burst open and I had a vaginal cuff dehiscence repair.
Oh my, okay, so
there's just like,
that's really, in my mind, that would be the reason why you have recurrent infections, because the body is set up to basically you have a vulnerability in that area. Totally. And when you have a vulnerability, the bacteria or viruses will take advantage of it. That's just the way it is. So key is to not think of it as just a simple bacterial infection that's treatable by antibiotics. The people who treat you should look at your urine samples in detail.
Right.
Look at whether are there actually bacteria. And when they say bacteria, they almost always mean E. coli. But in an older woman, especially with this history that you described, it doesn't have to be only E. coli. It could be many other different types of bacteria, because when you have the vulnerability, your exposure and vulnerability expands to include a lot of other bacteria, and including and also non-bacterial like Candida, just yeast infections.
Right.
Floating around.
Luckily, I don't have that. Thank goodness. But yes.
Yeah. So people should do urine analysis, as it's called, to test that. Like, what else? What is there? And are you getting a lot of shedding of the lining cells of the bladder? And what kind of immune cells are coming? So that at least gives you a full picture of what's going on. And that's easy. Urine analysis can be done in half an hour, in addition to a culture. So that's, and then based on that, there is, of course, vaginal estrogen, which you mentioned.
I love, yes. I think is a miracle drug, yes.
And then there's a sugar called D-mannose, which we are, working on as well, and shown that D-mannose really, really is very helpful. It's just a simple sugar. You can take it in your tea and coffee, and it's just amazing because first, D-mannose, if there's bacteria floating around in the urine, it kind of like gives them a little sugar to take them away. Okay?
Oh, interesting. Okay.
So that's one way that it works. but we're also now showing that inside your bladder, it can actually tamp down a little bit on the big inflammatory response. So it's useful both in the urine as well as in the bladder. And it's a simple sugar over the counter. You can go to GMC and buy some and take some. There's no harm in it. It's just a regular sugar.
Regular sugar.
And then another thing that we suggest is something called Hiprex. And it's called or methanamine hippurate. And this one is again can be given to any woman, not just a postmenopausal woman, because it's not hormone related at all. And what it seems to do is that it seems to prevent some of the leakiness in the bladder and prevents what's called breakthrough infections, where once you had one and you may have another coming in from inside. So these are at least the medications, some over the counter.
How do you spell the one that you just said? Hip?
I'll write it in the chat for you. I
Okay,
think the public name is Hiprex. Let me just confirm.
Hipprex. Thank you so much. Okay, I will look for that. And then
it's only one P.
Oh, one P. Hiprex. And then in terms of antibiotics, so for example, my body's now becoming antibiotic resistant. What do I do about that?
Found is that
wait, I couldn't hear you for a second. Yeah.
What we have found is that if you have a lot of active E. coli in your urine when they do the culture, then they have to give you antibiotics, and they have to go to the next level, I guess. But if they don't see a lot of bacteria, usually a lot means over 1,000 bacteria in 1 milliliter of your urine. That's a cutoff point. So if they see 1,000 bacteria or less, then antibiotics are not needed because your body is kind of taking care of that. But instead, you have a lot of immune cells in your urine. You have a lot of bladder mucosal cells in your urine that are shed. All that is saying is that the environment is disturbed. And antibiotics is not going to fix that. But taking D-mannose, vitamin C, like in lemon juice and something, certainly a lot of fluids. And
I mean, I carry one of these around all the time. So
yeah, and Hiprex and all these things then help, and also some pain medication, because a lot of the discomfort is because it feels painful. So take some pain medication.
Like Aleve or Advil or something like that?
What's that?
Like Aleve or Advil or something like that?
Aleve or Advil or something like that, exactly. And then, and then sort of the on the mental side, meditation, centering and yoga and, all these things together kind of tamp down on the stress and the reactivity along with the medicine. So these things for the most part help regress those lesions I told you about, and usually almost always make the women feel much better.
Oh, that's great to know. And let me ask a few logistical questions as well, because there are things that I've always wanted to know. So for example, in the act of vaginal sex, does the urethra get crushed, and does this crushing of the urethra perhaps trigger the infection?
No, that does not happen. So what does happen, or what can happen, and this is true in premenopausal women much more than postmenopausal women, not because of the age of the woman, but because of the condition of the tissue. And that's because in general, during vaginal sex, bacteria that are in the anal opening, in the what's called the periurethral space, basically the little space between the anal opening and the vaginal opening, can push bacteria up into the bladder. That is true. But that happens all the time. But that doesn't mean that every woman who has sex ever gets a UTI. Because it has to be that you have certain kinds of E. coli that can cause UTI, and to have them in enough number that they can go up there and cause this infection. So several things have to happen. Second thing is that, so that's one thing in general. So it has to be the type of bacteria, then the amount of those bacteria to cause the infection. Second thing is that as we get older, there's a lot of bacteria in our vagina. most of them are lactobacilli, which are called the good bacteria. They
Mhm.
keep the pH down, they keep the environment protected, because the vagina is the gateway to the uterus and the
Right.
womb, so it has to like keep it protected. So all the bacteria kind of like making sure that this area is protected from any bad things going up into the uterus. But then as we get menopausal, postmenopausal, then some of the types of bacteria that are good bacteria, their numbers go down.
Okay.
And this is hormonal. This is definitely hormonal, because estrogen hormone, which is the one that goes down in menopause, provides a breakdown product which these good bacteria eat.
Right.
So as estrogen goes down, these good bacteria have less food, so their numbers go down. And when they go down, it becomes more competitive for E. coli to establish themselves. That's why vaginal estrogen works.
And it did work for me for a long time. Yeah, it worked for a long time.
Vaginal estrogen works because it restores these good bacteria back into the system. And so now when you have bad bacteria sitting in the vagina, even more likelihood that these bacteria will go up into the bladder and cause more infections. So that's the linkage. I mean, and in terms of the urethra, sometimes if the urethra is irritated or inflamed, that doesn't cause infection. It just means that the whole environment is a little bit more inflamed. And paradoxically, some bacteria, like if your body is more inflamed, they're even more likely to infect you than when you're not. And it's a paradox, but in a way it makes sense, because level of immune response to go from 0 to 10 maybe to deal with an infection. And it's always a game. It's always like a cat and mouse game. So if you've got, our bodies are full of bacteria, and most of the time we're healthy, we're fine. But if those numbers go up, then we have to up our immune cells to attack them.
Right.
And if their numbers are down and we have a lot of immune activation, then we get autoimmune disease.
Right. Like lupus.
Okay?
And
like lupus, exactly, which are all very common in women because it's all the nerves, hormone connections. But then if we don't have autoimmune disease, but we're like just hyperreactive, and like the whole area is inflamed and burning and irritated and stuff like that, then we're kind of too busy with that. So then sometimes bacteria can get in, and these guys don't attack the bacteria. They're just busy like attacking themselves. And so sometimes the bacteria can come through and actually like large in number, but they kind of spread out and cause more irritation. And then it sets up this auto-irritative kind of a cycle, which again is very common in the lower urinary tract. So and that has most likely do with nerves. So we have talked about our mucosal cells, we talked about our bacteria and our immune cells, but we also have to, and our muscle cells for the bladder, pushing everything out versus retaining urine. But the last thing is the nerve cells. So nerves are always like monitoring, sensing our environment and sending information to our brain. And then as we get older, and the mucosa has changed a little bit, all these immune cells are now sitting there in this lymph node, different bacteria are showing up, and sometimes the nerves don't send the right signals to the brain. They may not, sometimes they don't tell the brain that there's something happening. Or they tell the brain that some shit's going down all the time. So then the brain gets overstimulated and doesn't send the right things to deal with in the bladder. And so then there's that other line of thing, so in your surgeries, for example, you could have easily had some nerve damage, right? Totally. Because when they operate, it's not like they'd messed up or anything, but just operating in that space, you will damage some nerves. Yeah. I mean, childbirth damages the pudendal nerve, which sometimes you get 3 children already. Yeah. Yeah. So when you have children, that damages a lot of nerves in the urethra.
So wait, here's a crazy question. Why did we learn in high school biology that urine is sterile? It's definitely not sterile.
Yeah.
Wait, I missed what you said.
It is. It's how it goes. Like we have certain knowledge, but science is a process of discovery, right? We're always discovering. And then people, especially men, back in the day it was all guys. They only know some stuff. And so then they just decide things, like they said, all the hysteria they think came from the uterus. So
Right.
then they used to remove the uterus of people, and then they say, oh, that improves them, like, I mean, it was just so bogus. It really destroyed so many women's lives. But
I know.
I mean, I can't even go through the history of reproductive practices by men throughout ages. I mean, absolutely brutal, sadistic stuff that
Well, I
people
mean,
have
even
done.
my
But
own
anyway,
body.
so
Yeah.
that in our intestine we have a lot of bacteria. No
Right.
one argues with that. And then in our vagina we have bacteria. People can like see that fairly easily.
Yeah.
But in the urine, it's not that obvious. So they just decided it was sterile, and they just sit with it. And now we know that there's bacteria in the urine that live there. Same thing with the placenta. They say the womb is completely sterile. And so that means the baby grows in a completely sterile environment, and it never sees any bacteria until it's coming out into the world. But we know that there's exposure to bacteria because the fetal baby's immune system is developing the whole time and learning stuff, right? And so, but there's now a huge argument in literature, in science, that no, it's all sterile. I mean, but we know nothing is sterile. There's bacteria everywhere.
Well, I was going to say, even in my own body. So when I got my hysterectomy, I was told to leave in the cervix. And it was said to me in the passive voice, it is believed that the cervix plays a role in sexual pleasure. So I said, well, who believes that? What do you mean?
Yeah,
and so I was told in 2012 to leave the cervix in. And 5 years later, it became diseased and had to come out because it is believed. Look, there was no study. Nobody knew anything about this. And then you're making healthcare decisions based on just hunches from men.
Yeah.
And then you get another 8-hour surgery. And then like me, you get vaginal cuff dehiscence, which was, thank God my daughter found me wandering around the apartment at 1:30 a.m. with like a bowl of blood clots. It's just crazy. It was crazy. Well, that's
why I really appreciate your putting the word out there, because I think that we have to actively advocate for more investment in women's health research. Our entire National Institute of Health, 4% or 5% of the entire budget only goes to women's health.
And also, in terms of urology itself, only 9% of urologists, I understand, are women. We need like 50%, because 50% of people have bladder, 50%.
Yes. But that's why I recommend people go to a urogynecologist.
Gynecologist, right?
Because, they're more and more. And certainly there's a number in New York that I'm happy to recommend you some names.
Yes, after we get off the Zoom, I'm going to ask for some names.
Yes, including people that have trained with me. So I'm happy to.
And last question is this whole bleach bath. Isn't that crazy?
Oh, please, no one ever do that. I mean, no, it's just a terrible, terrible thing. I have no idea. And all the Vagisil, all those washes, they're like horrible. They dry out normal mucosal things, normal, moisture. It's just terrible, terrible thing.
Well, I'm so glad my gut told me that. And I was like, I'm not taking a bleach bath. That's crazy.
I mean, that guy should be reported.
I might. Yeah.
That guy should be reported.
Yeah.
He's probably harming so many women, right? I mean,
yes, that's what I keep thinking. Like, if somebody, I come in there armed as a science writer, and even I walk out of there so confused, slut shamed, just feeling horrible, feeling disbelief. So I had one of the urine cultures came back negative, and then he went in there with his cystoscopy, and the entire bladder's inflamed, and his face was like, I was like, I'm telling you the truth. Something's going on in there, Anyway, I mean, just to not be believed alone.
That's what I hear women say the most, is that, a lot of these guys, they just don't believe us. They don't believe us. And that's why, like, I'm always like very particular about, like, I want to go to a urogynecologist, because at least they understand what you're saying. They believe you,
Absolutely.
And whether or not they can help you is a different question. But at least you start by being believed and being told, like, this is quite normal, and these are the things that we can do, and then you can decide whether you want to do them or not, so.
Well, thank you so much, Dr. Mysorekar. Mysorekar, thank you so much. I'm going to press stop, and then we're going to chat a little bit more afterwards. And I'm definitely going to fact check whatever I write with you, because there are a lot of a lot of
Absolutely.
things here. So let
And
me
I can
press
give you some
stop.
references as well.
Let me
Yeah.
press stop. Hold on. Stop.